Hi, I'm Scott Green. I'm a plastic surgeon at the Plastic Surgery Center, and this is Stacy Lassiter. She's our physician's assistant, and if you're watching this, you're wanting to know about gynecomastia. Let me tell you about it. Gynecomastia is something that happens to us men. What it is there's a hormonal imbalance in our bodies, and that can be created by a bunch of different things, and I'll talk about that in a minute, but a hormonal imbalance in our body that causes us to develop more breast tissue. And that breast tissue can sometimes stay and grow and be prominent even into our adult age. So when we're young boys, before we have hormones circulating through our body, testosterone, and when we're young girls, before we have hormones circulating through our body like estrogen and progesterone, those hormones, when they occur, affect how our body grows and affect a lot of the differences we see in boys and girls. And this process begins even in utero as we're embryos and continues throughout our life past menopause and into a man's older life. So this hormonal balance that we have is very, very important. All of us have at least a little bit of both of these hormones. And these hormones are very similar to one another. When we're young boys, and we start to have testosterone in our bodies in adolescence and during puberty, our body, if it sees an excess of testosterone, will try and convert some of that testosterone into its alternative form, estrogen. When that occurs, estrogen causes growth of breast tissue. It can even cause growth of hip excess fat or fat elsewhere in our bodies that can make our body look a little bit more feminine. Now, the breast area is the most common place we see that, and that can result in this thing we see called gynecomastia. This happens to some degree in all of us boys, but in almost all of us, it goes away. By the time we're 15 or 16, our body gets used to handling that testosterone, it goes away, and that hormone testosterone takes over, and it's really the predominant hormone, and so the breast tissue diminishes. We all have breast tissue. And so if there's estrogen present in a high enough quantity, it can make some of that breast tissue grow. And some of that breast tissue needs to be there. And that concept is important as we talk about what we're going to do surgically. Here's some other important things to talk about first, though. Not only does this occur in our body normally, and not only do these hormones surge in our bodies and then settle back down as we go through puberty and get into our older teens and 20s, but other things can affect these things as well. So, things for you to know when you have gynecomastia are, how did I get this? Did I follow the typical scenario of a boy who had it when I was 11, 12, 13 years old, and then it started to go away but didn't completely go away, or stayed on one side or stayed on both sides? Did it continue to get worse through my teenage years? Did it ever plateau? And was anything I doing, did anything I did or was anything I doing making that worse? So what can you do to make this worse or make this come on or create this problem? A lot of people that we see for correction of gynecomastia have used different kinds of medications in their lives. Some types of the medications doctors prescribe you might create gynecomastia, but some types of the medications that we take that doctors don't prescribe, that we might even get over the counter, something at some vitamin stores or GNC health stores. A lot of those places have testosterone boosters, and these testosterone boosters that we take orally can increase our estrogen production as well and result in gynecomastia. In addition, anabolic steroids can increase our estrogen production because, again, it throws that balance off. Testosterone goes higher and our body tries to compensate for that by raising the estrogen level or converting some of that cholesterol molecule that is testosterone to a cholesterol molecule that is estrogen. And that increase in estrogen can result in gynecomastia formation in our bodies. Other things can do it: alcoholism, heroin use, cannabinoids, which is marijuana, which is now legal in the state of California. Marijuana can definitely cause an increase in estrogen cause production of that estrogen in our body and increase in gynecomastia. So we see a lot of people with that exact scenario, that's caused it, or can even, once we remove it, make it recur. And that's an important concept to think about. Are you doing something that is causing that to stay, that's going to cause it to recur if we do surgery? So when you discuss these things with us, it's also important for us to know these things, because there are some other issues that you may not be aware of. Our body can form different types of tumors, or different areas of our body can secrete different hormones, and possibly even not enough hormones. Low testosterone, interestingly, can also cause gynecomastia. Excess production of other hormones or chemicals in our body can cause gynecomastia. And so if you don't fit the typical scenario of what we've just talked about with gynecomastia, perhaps you have gynecomastia from one of these other ways where your body is producing it. And in that case, we need to do some studies on you, some labs, to make sure that there's not some other chemical in our body that's causing a problem for you, that's causing this gynecomastia, that we need to address before you have surgery to correct the gynecomastia. Surgical correction of gynecomastia is pretty simple. It's done in two ways, by direct excision and by liposuction. Both ways work. Sometimes you need both, sometimes only one. Just depends on your exact situation. When we examine you, we'll be able to tell you what we recommend. Most commonly, I do a combination of both, a little bit of liposuction and direct excision. We do a direct excision when there's a very firm, hard glandular tissue nut right below your nipple. That can't be removed by liposuction, so we have to directly excise that. But it's important to comprehend, again, what I was saying earlier, that all of us have breast tissue. We all have breasts, we all have nipples. And so there's breast tissue in all of us. And when we do this surgery, we have got to leave some tissue below your nipple. Now, I know as a man, I don't want tissue below my nipple. I want my chest to be lean and perfect, and especially if I work out all the time, I want there to be nothing below my nipple. But the bottom line is, it's there naturally, and we can't completely remove it. If we do, we're gonna get skin stuck to our muscle, and then when our muscle flexes, our skin's gonna follow, it's gonna create a dent in our chest, and it's gonna look really weird, worse than the gynecomastia. So, we've got to leave a little fatty tissue layer, a tiny, tiny thin wafer of breast tissue, not usually enough that you can grab a big chunk of it, but a thin little wafer so we don't create other problems. What we want to do is leave you perfectly natural and normal, the way a man's body is supposed to be. And again, if we remove too much, we can create as much or worse of a problem than if we leave gynecomastia there and don't touch it at all. Also important in that is, once we've done surgery, these things that I mentioned earlier can cause gynecomastia. We got to be real careful to try and avoid as much as possible, or there is going to be a risk that it's going to come back for you. Gynecomastia recovery is usually pretty simple. You just have two small incisions, the liposuction incision, which is only a couple millimeters, and a small incision around your nipple, which is less than an inch typically. Those usually hide very well, usually heal very well. We tell you to avoid things like strenuous exercise for 4 weeks, or going back to the gym for 4 weeks. We also tell you to avoid getting in pools, jacuzzis, submerging, so your incisions don't get wet. And we have you wear a compression garment. The compression garment is super important in us preventing things like a hematoma. Hematomas can occur in gynecomastia. That means blood collection in that area that we remove that tissue from. And if blood collects in that area, it can sometimes mean we have to go back to surgery. And so we want to avoid that occurring. You avoiding strenuous exercise is important, and the compression garment we put in helps keep things collapsed, help it heals as fast as possible, and helps reduce your swelling, which is going to make you feel better sooner. You wear that compression garment for 4 weeks, then you can remove it, then you can return to exercise. Life's pretty normal after gynecomastia correction within just a day or so. You're usually off pain medicine, doing well. We do send you home with a pain medicine, with an antibiotic, and with an anti-nausea medicine. You take the pain medicine or the anti-nausea medicine as needed. The antibiotic I want you to take for 3 days afterwards. Then you don't need anything else. Just keep that compression garment on. You'll come see us a few times after surgery for post-op visits. We'll examine things and see how things are healing. At first, it's going to feel like there's still too much breast tissue there. That's swelling. Don't worry about that. That's going to go away with time. It takes months and months for 100% of that to completely diminish. That's pretty much it. Can you think of anything else on gynecomastia?
I think you covered it.
Alrighty. There you go. That's your gynecomastia consultation. We'll see you soon.